This is going to be short and sweet, but one of the things that Ian challenged us to at the very beginning is, why are we doing this? Why are we here? What's this wonderful job we've got, and why and how are we helping young people? So once a month at our commissioners meeting, we actually share a family voice. We actually ask for a family or a young person within the family to come along and tell us about something that our service has done with them or for them. And we enjoy that session, don't we? Not that we don't enjoy the rest of the meeting, but usually it helps lighten the load and we all go, yes, that's why we do this job. So after this session, there will be some short clips of families and young people who have shared their stories with us. So please, if you get the opportunity when you're having a cup of coffee, to have a look at those. But what we've got today is we've actually got a story about a family in the West Quadrant, and we're going to just listen to the support that they have had. And I hope it reflects on some of the things we've talked about today. We identified a need and we worked with a partner and we looked at how we could go to the family who, in this particular case, they couldn't come to us. They're in the NICO unit in Harlow. And so we went and looked at how we could work together in partnership. We could help the mum who felt she was isolated, and we delivered a service. We hope that when she came out, she felt less isolated. She actually knows where she can get other services from. And indeed, we hope that she also appreciates a seamless referral system. And hopefully you'll see the story of Jack and his mum, April.
The FAB project is the Families and Babies project. It's where the Healthy Family team works in partnership with the NICU unit at Princess Alexandra Hospital to work with the families there. The need for the Families and Babies project was identified as every baby that is born then gets straight away input from the health visiting team, and obviously babies in the NICU unit don't get that face-to-face support straight away. So it was put in place that a Healthy Family team member would go in weekly to liaise with the mums there, so they're included as well.
Our integrated targeted service, which provides health visitors and healthy family support workers with antenatal data from 28 weeks, is very beneficial, especially if you have a baby who is born prematurely. Then we have access to that information through information sharing forms. We're able to liaise with midwives and have care put in place before that baby leaves the hospital. So through benefits of true integration, we are able to offer a fully comprehensive supportive service to our families, involving all of our health professionals and also other agencies with regards to maybe maternity or hospital or GPs.
The integration works really well. When on the unit, we have regular chats with the families weekly to see how they are emotionally. From that, we can identify the outcomes that they want to have supported. So that could be their emotional well-being or their bonding and attachment with the baby. Following on from that, we'd make a care plan and work with the family to sort of support them with those needs through accessing groups, through regular visits from the health visitor, or just a listening phone call to make sure they're doing okay week by week. As the family support for Jack, he obviously had the NICU staff involved, Healthy Family team, health visitor and healthy family support practitioner for the 6 to 8 week check and new birth visit and monitoring weight gain. Mum and Jack have accessed the Healthy Family team regularly since discharge from NICU. Mum first came in for the self-weigh facilities, during which she was signposted to the baby beginning sessions, and then over Christmas was able to use the self-weigh facility to empower her to weigh Jack by herself.
Jack needed extra care, so he was taken straight into NICU. I was on the Sampson ward recovering, but because I didn't have Jack with me, the midwives didn't attend to me as much as they probably would have done if Jack was with me. So yes, on the first night I did feel a little bit isolated. Our health visitor Lucy is in contact with us weekly. For me personally, as Jack's mum, I worry about his weight, but with her support I don't anymore. Lucy actually put me in contact with baby beginners, and from that I met a lot of mums who I'm currently in contact with still now. Since joining the group at the Hub, do I feel isolated? No, absolutely not. At the Hub they really encourage you to join groups, and you've always got a healthcare professional there if you've got any worries. But it's just great to have such a good support network, and the Hub provides that. So they're fantastic.
So what happens if Jack needs extra support? For example, something like speech and language. We can provide this support direct to the family, as we are all working in a family hub model. Due to us working in such an integrated way, the referral process is seamless. It allows us to refer families for additional support without them having to tell their story again and again. The network of partner agencies include our subcontracted services from Homestar and Community 360, and they ensure our children and their families have an accessible support network around them.